Welcome to my channel Natural Cures. Bad breath. Bad breath, in English, halitosis, is a common problem that affects people of all ages, as 1 person in 4 suffers from bad breath, and people suffer from bad breath coming out of the mouth that others feel, exposing them to embarrassment, and from the most important causes of bad breath, the increase in the number of bacteria and as a result of the lack of attention to its cleanliness, which would secrete toxins and analyze food residues, resulting in bad-smelling gases, and among other causes of bad breath. Eating foods with strong odors such as onions and garlic, in addition to smoking and drinking alcohol, and it is worth noting that gingivitis, tooth decay, and buried teeth also lead to the exit of a bad smell from the mouth, as well as some diseases such as kidney disease, liver, sinusitis, influenza, and cold, and gastroesophageal reflux disease, in addition to stomach diseases and dry mouth, as well as some types of medicines such as antihistamine and diuretics, in English, diuretic. Methods for removing bad breath. The method of removing mouth odor depends on the underlying cause. If a person suffers from a health problem that is the cause of bad breath, then the dentist must refer the patient to the primary health care doctor. But if the mouth odor is caused by the teeth, there are many procedures that can be followed to remove the smell, and we mention the following. Maintaining the health and cleanliness of the mouth and teeth, which includes brushing the teeth periodically and regularly, in addition to cleaning between the teeth, and it must be known that toothbrushing alone does not clean more than 60% of the tooth surfaces, and it is also recommended to use a toothbrush with a small or medium head, and that the bristles are soft, in addition to changing them every 3 to 4 months, and it is advisable to brush twice a day, and that the period of brushing should not be less than 2 minutes each time. The use of mouthwashes, in English, mouthwash. Oral washes contain active substances that kill germs, including bacteria, and they neutralize some chemicals in the mouth that would cause bad breath, and these active substances include chlorhexidine, and chlorine dioxide, and zinc chloride, and triclosan, and it should be noted that mouthwashes that contain chlorhexidine should not be used for long periods because of its side effects, whereas using it for long periods of time leads to temporary discoloration of the teeth and tongue, as it has a sour and unpleasant taste, and the frequent use of mouthwashes containing alcohol is one of the risk factors for cancer, and it is advised not to use mouthwashes by children, for fear of swallowing it. Tongue cleaning. There are special tools to clean the back of the tongue called tongue scraper. It is a plastic tool that can be bought from the pharmacy, where the tongue is gently scraped from back to front to remove the layer that covers it, and there are some people who clean the tongue with a toothbrush soaked in mouthwash liquid. Treatment of dental problems. It includes treating gum diseases that cause gingival pockets that are filled with bad-smelling bacteria, and the doctor must advise his patient to repair or change the damaged fillings. Maintaining the cleanliness of dentures. They are cleaned with a toothbrush that is designated to clean the dentures, and denture cleaning tablets or a cream for cleaning them are used, and it is advised to avoid using toothpaste because it causes scratches on the surfaces of the dentures, which subsequently lead to its discoloration, and cleaning will prevent the formation of plaque that causes bad breath. And it is also advised not to wear dentures at night. This is to give the gums a chance to rest. One of the home recipes that treat or relieve bad breath is chewing parsley or mint leaves. Prevention of bad breath. There are many procedures that can be followed to prevent bad breath, including the following. Brushing the teeth. Brushing the teeth must be done at least an hour before or after eating, and this is done using toothpaste that contains fluoride. And there are some types of toothpastes that have the ability to kill bacteria, as these types help to treat and reduce bad breath. Interdental cleaning. This is done by dental floss. This is to remove food debris stuck between the teeth, and it is also possible to use interdental brushes, and it is advised to brush between the teeth at least once a day, as this would reduce the chances of bad smell from the mouth. Avoid dry mouth. By making sure to drink large quantities of water and chew sugar-free gum. In order to stimulate the production of saliva, it is also important to avoid tobacco, coffee, alcohol, and soft drinks that make the mouth more dry. reducing the intake of foods that cause odors, such as onions, garlic, and foods high in sugar. Seeing the doctor, it is important to follow up on regular visits to the dentist's office. Please subscribe and likes and commenter.